Today, I'm going to talk about female hormonal problems. As a doctor, I actually categorize female hormonal problems according to different age groups. There are certain types of hormonal issues during teenage years, a different set in middle age, and another kind of hormonal imbalance that occurs after 50 or in old age. First, let's talk about the problems that teenage girls face. There are some very common problems that can be identified from their symptoms. But when we, as doctors, investigate further, we often find that they have hormonal issues. For example, among teenage girls, the majority experience severe hair loss, acne problems, irregular periods, or sudden unexplained weight gain. These problems are very common. They go to many places, consult many dietitians, and visit dermatologists. They try different treatments. But even after all that, these issues are not being cured permanently. And when we, as MBBS doctors, check them, we look at their hormonal profile. That's when we see that there are various types of hormonal imbalances in their bodies. Among these, thyroid dysfunction is very common. Females, especially teenagers or those under 25 or around 30, are suffering a lot from hypothyroidism. We see that they have thyroid dysfunction, and from there, problems like acne, unwanted hair, and hair loss arise. Besides that, we also see that many have polycystic ovarian disease, which we can easily detect through ultrasound. We find that their ovaries have small follicles or cysts, and this disrupts all kinds of hormones in the body. This hormonal imbalance also causes various symptoms that may initially seem skin-related, but are actually due to hormonal imbalance. Of course, dermatological treatment is necessary to address and manage these issues. But if the internal hormonal imbalance is not corrected, these problems will never be solved permanently. Even now, our dermatologists are saying the same thing and are conducting these tests. When a female comes to them with such problems, they check her thyroid profile, do an ultrasound, and test other female hormones, especially cortisol, which is important here. We are all looking at these things. So, PCOS and hypothyroidism are generally major problems for females in their teenage years or under 30. And I want to say that PCOS or hypothyroidism is actually one of the main causes of infertility in the future. Now, if I divide it further, what happens in middle age? When we have children or when our age reaches 35 to 40 or goes above 40, some very common hormonal problems start to appear in our bodies during this time. There is a menopausal state, so at a certain point, every woman's period or menstruation stops. And in Bangladesh, this usually happens between the ages of 45 and 50. Just before this, many types of hormonal imbalances start to occur in women. Among these, mood swings are very common, suddenly getting very angry or becoming irritable. There can also be sleeping disorders, of course. In addition, some women experience a burning sensation in the body or in the palms of the hands, soles of the feet, or even on the head. Some even gain weight. We call these PMS or premenopausal syndrome. So, what can we actually do about premenopausal syndrome? Every woman will go through this phase in her life. So during this time, you definitely need to take extra care of yourself. If you have any special conditions like thyroid issues or PCOS, it's possible to manage them by consulting a doctor. In the same way, premenopausal syndrome can also be managed by seeing a doctor. What happens is that different types of hormones in our body become imbalanced and inactive. So it's very important to bring those hormones back into balance and keep them active. To do that, we need to follow a healthy food practice, including plenty of antioxidants, vitamin A, vitamin K, vitamin E, and of course, don't forget calcium and vitamin D. Because during the premenopausal and postmenopausal periods, due to this hormonal imbalance, women's bones often become very soft and brittle, and many also suffer from back pain. So, it's essential to include vitamin D and calcium supplements along with your daily requirements. Supplements are a must as well. Along with that, you need to increase your intake of antioxidants and develop the habit of a healthy diet. Regular exercise is important, and to protect yourself from mood swings or irritability, you should try to maintain a proper sleep pattern. And I want to emphasize again that family members, whether it's your husband, children, in-laws, or parents, all of us need to give her a lot of psychological support during this time. It's actually quite possible to overcome this premenopausal syndrome easily with the right support. But if that's still not enough, you should definitely consult a doctor, and the doctor will decide whether you actually need any treatment or not. After that, the same thing happens. We say that when a person or a woman's period or menstruation stops, what occurs is called postmenopausal syndrome. So, the symptoms that are present during premenopause are basically the same, just a bit different. These symptoms appear in a more exaggerated form during postmenopause. After 45 or 50, when postmenopause sets in and periods stop completely, these syndromes come back and they return in an even more severe way. Because of the increased age, dealing with these symptoms becomes very difficult for a woman. At this time, the dietary habits that were recommended during premenopause must also be maintained during postmenopause, and regular health checkups are essential. During this period, many women even develop various diseases. One very common disease among them is ischemic heart disease, because the sexual hormones or female hormones we have are not just for regulating periods or sexual performance. These hormones help our body's metabolism and, in many cases, help maintain proper heart function. When these hormones become imbalanced, the risk factor for ischemic heart disease becomes very common for women aged 45 to 50, and sudden weight gain can also occur. As a result, the risk factor increases. Besides this, many women develop diabetes. Blood sugar levels rise, often due to being overweight and consuming too many carbohydrates. Increased carbohydrate consumption or overeating, meaning the urge to eat more, is caused by this hormonal I. It is often seen that during this time, there is an overwhelming and intense feeling of hunger because depression can set in, and for many, such as those struggling emotionally, at this point, anxiety also becomes a significant issue, making it increasingly difficult for individuals to manage their thoughts and emotions effectively. Serious illnesses can start to develop over time, so this postmenopausal syndrome must be taken very seriously and not ignored, especially for women who are older in the family and should be watched with great care and attention. Zirk. For many, prolactin levels can be either very low or very high. Because of this, it's a very common problem, and I would say that for our country, it's a huge burden. Because in our country, there are a great number of people, situations, and circumstances that contribute to the way things are, and this abundance of factors often leads to unique outcomes and experiences that are not always easy to explain or summarize in just a few words. This can truly help you achieve and maintain a healthy and happy family life. I sincerely appreciate your attention and support. Thank you very much, everyone.